This is the Insta-Clinic of Dr Wassim. Please be advised that some medical imagery may be unsuitable for young viewers. The doctor will see you now.
Welcome to the Insta-Clinic. I'm Dr Wassim Taktouk, and today's Insta-Clinic will be spent answering your questions about coronavirus. The coronavirus has come a long way since it was first discovered in Wuhan, China in December of last year, and it's made its way around the world, creating a terrifying pandemic. Alongside the spread of this illness has been the spread of misinformation. And judging by the questions that were sent in for this Insta-Clinic, it's quite clear that we're all still quite confused about what is fact and what isn't. Although coronaviruses themselves are not new to us, COVID-19 is, and it's a disease that humans haven't experienced before. It's new to us, and therefore our knowledge about it is quite limited. So I have asked my friend Dr Javid Abdelmoneim to come on board to answer some of these questions. A bit of background about Javid. He's the president of MSF-UK and has a wealth of experience in dealing with worldwide emergencies, whether they're natural disasters or things like the Ebola epidemic. He is also a London-based A&E doctor, so he's at the front line dealing with this emergency.
Wassim, thank you for having me. It's nice to be working with you again. We first met, of course, on the wards in 2003. And here we are doing a little Insta-Clinic together. As you said, it's true, there is so much information out there and misinformation about COVID-19. And I think that reflects the fact that it's a brand new disease. There is not an established body of evidence around this. And when you combine that issue where there's a gap in knowledge that can be exploited with a generalized anxiety and understandable concern around the world at the moment, then unscrupulous people can take advantage and spread what is incorrect information. The virus is thought to have spread from wild animals to humans in central China, as you well know now. This isn't the first time viruses have crossed species. For example, HIV was originally in primates and monkeys. Ebola is thought to live in bats and crosses into humans when they're hunted and eaten. MERS, so it's Middle East Respiratory Syndrome, and that jumped from camels to human breeders. So there are plenty of viruses in the world that switch and jump species, and that's just when they become really quite concerning for us, because if none of us have ever met this virus before, there's zero immunity in the population, and that's what gives rise to the potential for a pandemic, especially if human-to-human transmission can occur efficiently. There are unfortunately no known treatments for this virus. It is brand new to humanity. There have been a lot of whispers and rumours. There has been a certain president putting out information that chloroquine or hydrochloroquine, when combined with another well-known antibiotic, may well work. Well, that's pure speculation. There may be anecdotal signs that 1 or 2 or 5 or 10 patients did better with these medicines, but there is no hard scientific fact. So trials are ongoing. What evidence has come out isn't as robust as it should be, and so medics will always try to do the best they can. And if there is a medicine or a novel combination of existing medicines that we think might work, we will try them. But right now, there is certainly no concrete proof whatsoever that the population out there should start taking chloroquine or hydrochloroquine in an attempt to remain well while coronavirus is circulating. There are lots and lots of symptoms of COVID-19, but the main ones are fever, new continuous cough, or shortness of breath. It is a virus that attacks the respiratory system predominantly. There are, however, some other symptoms that you might feel just like any viral illness, a bit like the flu. Aches and pains, sore throat, headache, fatigue. And also, we have seen some patients who only present with GI symptoms, so diarrhea and vomiting. Recently, there have been multiple presentations around the country with people who have lost their sense of smell and taste, which is very unusual. At the moment, we in hospital are taking that as a really sensitive common sign of COVID-19 disease. So for example, if you lose your sense of smell and taste, and for example have a bit of a sore throat, a headache, and just the tiniest cough, I would regard that as COVID-19, and you should then self-isolate for 7 days. It's not quite yet known exactly how much. I've seen some evidence coming out of China that around 25% of all transmission of infections happens before patients know they even have symptoms. And that's part of the reason why the current social distancing is so important. Because if we're all out and about while we have no symptoms, but are still spreading it, that's a very dangerous situation to be in, hence needing to stay indoors as much as possible. But when we're going to get hard and fast evidence about how many days before symptoms you are shedding how much virus and whether that amount of virus is enough to cause severe disease or mild is still not known. That type of information is known for influenza, but it's been around for a good old time for us to study, and this is still too new to know. People of all ages will be infected by COVID-19. People of all ages will have severe disease. So those two are facts. But when you tease it apart and try and see the frequency, how many in each age group get severe disease or sadly die, it's really hard to tell, because actually it depends on the testing strategy of that country to really get a pure picture of the total population. However, if you look at the deaths that have occurred, for example in Italy, say in 100 deaths, when you look at their numbers, actually 10 out of those 100 were people in their 40s, 5 out of those 100 were people in their 30s, and 2 out of that 100 were people in their 20s. 17% of deaths in Italy are in people below the age of 50. So this is not just exclusively an illness that causes death in old people. We all need to be careful, wash our hands, follow the social distancing rules, and at the moment that means, you guessed it, staying indoors unless going outside for exceptions. Wearing a face mask while outdoors has potential for benefit, but there is absolutely no substitution for hand washing. Now, why I say the face mask might have benefit, because for me, if I was wearing a great big mask on my face, it will remind me not to touch my nose and eyes and mouth without washing my hands first. So in that sense, it could be useful. It actually also could be useful if you are going to forget to catch your cough or sneeze with a tissue. So the mask will catch it, in which case you should dispose of that quickly afterwards when you get home. So there are potential uses, but in and of itself, wearing a mask is not necessarily going to protect you from COVID-19. What is rigorous and frequent hand washing. There is evidence that this coronavirus can last on surfaces up to 3 days, particularly if they are hard and shiny and glossy. For example, the hard plastics of remote controls, stainless steel of our appliances, it can last for up to 3 days. You should practice at this time, if you've been outdoors, if you're bringing anything into your house, if you're getting that takeaway delivered from Deliveroo or otherwise, try and just get into your mind that anything coming in through the front door is possibly got virus on it. At the very least, try and give them a good wipe down. Warm soapy water needs a bit more contact time, or a appropriately diluted bleach spray needs a bit of a less contact time. Give them a good wash down, and always, always, always wash your hands before you eat, immediately before you eat, and before you do anything like this or this. What I would say is, unless you know for sure that it's nationally validated, at least from the WHO or from Public Health England or from wherever your national agency is that you're watching this, if it's not validated and you know for a fact that it has the highest degree of sensitivity as possible, I wouldn't trust any kits for home testing or private testing that are out at the moment. You've also got to distinguish between the two different types of tests. There is the current swabbing, which is looking for actual virus in your nose and throat area. That is a test for live infection. Then there's a different type of test which is likely to be from blood testing, which is to look for antibodies, which is your immune reaction to the virus, which will tell you whether you've had the disease and whether you might have present immunity. So far, there's no evidence that this virus is mutating very rapidly, and so it is not thought that there are more virulent, more severe disease-causing strains in different parts of the world. That also means that the chances of getting a vaccine that lasts rather than needing a new one every year seem quite high, which is good news for light at the end of that tunnel. In terms of whether getting an infectious dose, a higher dose into your body means you have more severe disease, there's still no evidence of that, but there's still no evidence against that. It's still so new, so at this time it's unknown. That's a really good question. There have been reports of patients testing positive a second time. Now, the theory is potentially that these tests, which quite literally pick up viral segments, viral pieces, and amplify them to see if they're there, are sensitive enough to pick up the odd viral fragment after you've cleared yourself of being heavily infected. And these are not viable, live, so to speak, virus particles that are replicating and causing you infection, yet they're picked up by the test and you get a repeat positive. So that's the speculation. As with a lot of the things right now, there's no hard evidence that you can be infected twice. If you're at home and you have symptoms of COVID-19, however mild or moderate or even severe, the general message is if you feel you can manage them at home, do. Now, we in hospital would be applying a different level of filter, which is, do they need oxygen or not? Now, you're not going to know whether you need oxygen when you're sitting at home, but a good suggestion is that if you feel breathless doing something that you normally wouldn't feel breathless doing, if you're getting breathless just walking upstairs, whereas normally you wouldn't, certainly if you're feeling breathless whilst just sitting there on the sofa, you should be worried, I would be worried, you should be getting urgent medical attention. Listen, it is very similar in the sense that this is a disease that no one has immunity to, that has no cure, that has the potential and has overwhelmed health services and caused a total grinding down of what is normal societal activity. So in that sense, it's got a lot of parallels to Ebola. I find them also potentially to have lots of other similarities in a few more of the details. Healthcare workers are anxious, they're exposed to it. When patients are being admitted to hospital, they can't be visited by their loved ones until that moment of death. And that's really, really hard to deal with for everybody involved. So I can't really answer whether there's one is worse or the other. They're as bad as each other. One of you asked, quite funnily, whether you'll be able to go to Ibiza this summer. But many of you actually did ask the same question, which is, how long will this take? And the answer to that is, we don't know. The best estimate is that the measures that we're undertaking now in terms of social distancing will be on probably until the end of the year. Now, they might relax and become reconstrained, relaxed and reconstrained according to what the caseload number is, according to how the economy is doing, according to how people actually comply with the social distancing. We do need to get out. We're social creatures. So the government will be looking at multiple different factors to decide whether to relax the distancing a little, to put the measures back in place, to relax them, to put them back in place. When this will actually all be over at the end of the day is when we either have a safe treatment for coronavirus or an effective and safe vaccination. And that's a long time away. I want to wish you all good health and for your loved ones too. Happy hand washing. If you want to know more, I've got a new show out shortly. It'll be on April the 9th on Channel 4. It's about how to keep your home clean and disinfected after you've been outdoors. I think there'll be lots of really useful information there, so do tune in. Meanwhile, good health and wealth and happiness.